Well, welcome to the Daily Brief on Metro Milwaukee's Health and Economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the MMAC, and joined by my co-host, Dr. John Raymond, president of the Medical College. Each day at 3:30, we provide you with a 19-minute fact-filled update on the health and economic impact of COVID-19. This broadcast is powered by Aurora WDC. And we're joined again this Friday, as we have been the last couple of Fridays, with Mayor Tom Barrett to help us assess where we're going with COVID-19. But before we do that, let's turn it over to Dr. Raymond for an update on our healthcare status.
Thanks, Tim, and good afternoon, everyone. This first slide summarizes various indicators of COVID-19, and I'll run through these quickly. The doubling time for COVID-19 was stable at 14 days in Wisconsin, and it slipped a little bit to 17.7 days in Milwaukee. The daily growth rates over the last 7 days are stable, 3.9% in Wisconsin and 2.9% in Milwaukee. And there were 375 positive tests in Wisconsin today, which is the second highest total since we began tallying these on March 12th. And there were 149 new tests in Milwaukee, which is the highest single day tally since March 12th. And there were 71 new cases in Brown County. There were 8.1% positive tests in Wisconsin, and the data for Milwaukee are not yet available. In terms of COVID-19 diagnostic testing capacity, this has been stable this last week between 13,800 and 14,800. ICU and ventilator capacity has been adequate and is stable, and PPE trends are improving to stable both in Wisconsin and Milwaukee, with the most critical shortage right now being in gowns. Next slide, please. This slide shows trends for COVID-19 positive tests in Wisconsin and Milwaukee County since March 12th. And there does seem to be a plateau, but it's not clear that there's a downward trend of new cases either in Milwaukee or Wisconsin. And this isn't surprising because our testing capacity and number of tests administered have been increasing. Yesterday, there were more than 5,000 tests administered in Wisconsin, and today there were over 4,600, and that's more than double what we were experiencing just 2 weeks ago. Next slide, please. This slide shows trends for COVID-19 related deaths in Wisconsin and in Milwaukee County. Unfortunately, our deaths are much lower than in many other states, but it does appear that there might be a downward trend both in Wisconsin and in Milwaukee, but there's so much variability caused by the relatively low numbers, it's difficult really to see the trend. Next slide, please. This next slide shows the daily trends of tests administered, shown in the teal bars, and total positive tests, shown in the pink bars for each day. Milwaukee shown on the left and Wisconsin on the right. The black lines show the percent positive tests over the last 2 weeks. And both the numbers and the percentages of positive tests are Badger bounce back gating criteria. And as you can see here, there's really not a clear downward trend. Next slide, please. This next slide compares the trajectory of growth of COVID-19 in Milwaukee, shown in pink, and in the rest of the state, shown in teal. Now, the vertical axis shows the total number of new cases in the last 7 days, and the horizontal axis shows the total cases. Now, the data are shown on a logarithmic scale to make it easier to detect downward trends. The plots show that Milwaukee has done a little bit better than Wisconsin in terms of bending down the curve, and that was apparent about 2 weeks ago. But that downward trend was not sustained either in Wisconsin or in Milwaukee. And as I've said before, we've reached sort of an equilibrium with COVID-19. And these plots suggest that our progress may have stalled somewhat about 2 weeks ago. Next slide, please. So if we've stalled, did we stall in a reasonable place? I think the answer to that question is yes. Most importantly, we've never overwhelmed our hospitals, intensive care units, or ventilator capacity, and that was one of the primary goals of flattening the curve. Now, to explore this idea just a little bit further, I'd like to introduce one more set of data that suggests that we've reached an equilibrium with the COVID-19 pandemic here. This graph plots what's called the reproductive number, or R0. The The reproductive number measures the contagiousness of a disease at any given point in time. Let's say if the reproductive number is 4, that would mean that one infected individual, on average, would pass the infection on to 4 people. If the reproductive number is 1, then one infected individual would spread the disease to one other person. So ideally, we'd like to see the reproductive number at less than 1, because then the pandemic would begin to fade away. So for this graph, I'll call your attention to the blue line, which shows the reproductive numbers for Wisconsin over time, and the tan line, which shows the reproductive numbers for Milwaukee over time. Now, starting at the left, you can see that we did start with high reproductive numbers early in March, and that meant that the pandemic was spreading rapidly at that time. But by early April, the reproductive number had dropped to 1, both for Milwaukee and for Wisconsin. Now, that improvement is directly attributable to social distancing and people staying at home. But we've stayed around reproductive numbers at or near 1 now for the last 5 weeks without continuing improvement or any significant worsening. Hence, we have reached an equilibrium or a steady state with COVID-19. So what does that mean for us when we begin a smart restart of our economy? Quite simply, it means that we all will need to maintain diligent adherence to social distancing if we want to avoid a surge of cases. Now, I completely understand that there's lockdown fatigue, but it's clear that we're going to need to redouble our social distancing efforts until we have a vaccine. That's if we want to successfully reopen our economy. So before I turn it back over to Tim, I do want to acknowledge Andrew Yasman from the Medical College of Wisconsin for providing all these graphs for us. And with that, I'll turn it back over to Tim.
Thank you, Dr. Raymond. Appreciate the kind of weak summary here. And as we've talked about this, we are going to have to live with COVID in some form for the near future, or as one of my board members described it as the new abnormal. So Mayor, as we kind of move into the new abnormal here, talk a little bit about the role you're playing in bringing together 19 municipalities in one county that are part of a 7-county region. And in a sense, it's a bit of a microcosm of what we've been dealing with at the state. And at some point, again, we're going to have to reflect on the local health issues, the local health capacity. And I know that's an effort that you're deeply engaged in.
Well, that's absolutely correct, Tim. And I think as you recognize, I think as everybody on this call recognizes, regardless of what decision the Supreme Court makes, there are going to be changes in the next week or possibly the next 3 weeks as to what our rules of engagement are going to be for, as you described, it's the new abnormal. We still are in a community here where we're seeing a significant number of cases. I will say where I have gained optimism is as I've looked at the mortality numbers for the last week, the fact that those are dropping is important to me. We've had fewer people die in the last week. And the reason that's so important is I think if someone fixates on the number of positive cases, they might be barking up the wrong tree, because the fact of the matter is, as we increase, and in some instances dramatically increase, the testing capacity, we are inevitably going to have more cases. And so I don't tie it as much to the number of cases that we have as I do to what are we seeing, how serious is it. And one of the other factors that I've seen just in the last few days is it appears that at least in Milwaukee, the age is moving younger, which creates some real dynamics here, because when it started out, the largest group was probably 50 to 59. Now it's probably 30 to 50 is the largest group of people who have it. So what we're trying to do is we're trying to come up with a solution that will obviously fit Milwaukee, but also fit the surrounding areas, the Milwaukee suburbs. I have been in contact with mayors from Racine and Kenosha, the city manager in Beloit. Others are looking to us as well, because we are urban areas where we're seeing more cases. You made reference to the M7 region. Of the 10 counties in the state that have the highest number of cases, all 7 M7 counties are among those top 10. So even though it's growing faster in other places like Brown County significantly, we still have the most number of cases here. So what we're doing in real time right now is we are looking at how we can slowly reopen the economy. When I say slowly, it's an understanding that there's not going to be, as people described over the last couple of weeks, this is not a light switch. And even if it were a light switch in terms of, okay, everybody can do everything they want to do, I think the reality, if you look at the public opinion polls, is that the public is still very, very wary about going out and I think being in social situations. And so that's going to continue to have an impact, I think, certainly in entertainment and sports and dining. It'll be interesting to see for the employers how much resistance they're going to have for people who are concerned about coming back to work. So those are all the factors we're trying to weigh, and I appreciate your involvement in this. Obviously, Dr. Raymond has been a key figure in all this. So we're trying to strike the right balance. That's what we're trying to do, and we're going to continue to try to do that as quickly as we can.
So how do you go about kind of building the public's confidence behind the plan that you roll out in concert with the neighboring communities? As you know very well, people are commuting in between different locations. And so as somebody said, what happens in one end of the pool is eventually going to show up in the other end of the pool. And so how do you go about building the confidence as people kind of come back to work and come back to the location where they are working?
Well, first I have to start with the assumption that we're never going to have total unanimity, that there's always going to be someone who's unhappy in one direction or the other. I think what our charge is to look at, okay, what is the impact this is having on public health? What is the impact that it's having on the economy? Quite honestly, one of the statistics that I saw this week that was troubling to me was the increase in suicide attempts, the increase in drug overdoses. So the despair factor, when people don't have money or don't have a place to go, that's a public health concern of mine as well. So I wish I had the exact answer on how we do it. And I wish I could say, well, we're going to do it and the public's going to love whatever we do. If I could do that, I'd be making a lot more money than I'm making now.
Yeah. So speaking of money, I know you have some challenging decisions in front of you as it relates to the city budget. And there's clearly been an impact, not only in the city of Milwaukee, but the state of Wisconsin. And the local and state finances are they've been impacted by COVID and are going to continue. So how do you look at that going forward?
Well, it's actually in two different columns. And I think this is where public education has to come in as well. When Congress passed the CARES Act, they allocated a good amount of money to communities like Milwaukee. We got $103 million for COVID-19 related expenses. And so a lot of the work that we're doing in the health department, other places where we're seeing an impact, we're able to use that money for expenses we've incurred as a result of COVID-19. We cannot use it for loss of revenue. And our estimates are for the first 2 months, it's been about $6 million. If this continues in the fashion we are right now through August, it'll be closer to $26 million. And that's just not the city of Milwaukee. Every other government from state to county to city is facing that. And that's why I think that this debate in Washington is going to continue. A possibility that I see there is, I know that there's a debate as to how much more money should go toward local governments. I do think that there could be some flexibility in the money that's already been allocated to them, because I don't know that we're going to have $103 million in COVID-related expenses, but that certainly would help us with some of the revenue loss we've had.
Good. Let's bring Dr. Raymond back in, and Chris, let's go to questions for the mayor and Dr. Raymond.
Sure. First question is for Mayor Barrett. I believe some free testing sites are coming online. Can you discuss those?
Yeah, and this is really good news in that we have started to accelerate the number of testing locations. And I can tell you for the first 4 or 5 weeks of this was one of the things that was making me pull my hair out, was I wanted more testing, because I viewed the testing as critical from a public health perspective, but I also considered it critical, and as I've described it, is literally the key that will allow us to unlock our economy. Because the more we can test and find out who's testing positive, have them isolated, do the tracing for their contacts, the more we can contain the growth of this disease and get that number even lower than that one that Dr. Raymond refers to. So Monday is going to probably be the most dramatic increase. And there's some controversy to this because this will be the first time that we will be offering asymptomatic testing. And it's going to occur on the north side of Milwaukee at Midtown, on the south side at UMOS. You do not need to have an appointment. You do not need to have insurance. And we're anticipating, we're working very closely with the state of Wisconsin, with Milwaukee County. The National Guard is doing the actual testing, and they'll have the ability to do probably 500 tests per day, and they're setting up for a week. In addition to that, our community health centers, we have 5 community health centers that are operating out of 7 sites, 3 on the north side, 2 on the south side, and that's offering testing as well. And the more testing we can do, I think the better off we are. The reason the asymptomatic is controversial, and maybe Dr. Raymond wants to weigh in on this, is some people feel that that's not where we should be putting our resources right now. But as we get more testing capacity, and what we're doing is we're working with Exact Sciences out of Madison, is getting the test to them, and they're going to turn them around hopefully within 48 hours.
Dr. Raymond, any thoughts on asymptomatic testing?
I think we should do it. We have excess capacity. There's a lot of mythology about how many people are asymptomatic and may have the infection. The best thing we can do is go study our own community.
Dr. Raymond, we had a couple audience members compliment you on still wearing a sport coat and tie during the pandemic. Very impressive. Also had another question about serology testing, when that might be available to the public, and also how valuable is that going to be, knowing that we don't really know anything about immunity yet?
Yeah, great question. What I would say is up to this point, most of the serology tests that were available weren't very good. They had high false positive rates, and I would refer to the studies in Santa Clara and Los Angeles as being deeply flawed because they used tests that weren't very good. Roche and Abbott both have very, very specific and sensitive tests that have come on the market now. So I think, again, I would love to just do those tests out in our community so we can know how many people have actually been exposed to COVID-19 in the past. That'll be important. Whether that's going to correlate or not with immunity remains to be seen, but I think all of us are hopeful that if you have antibodies, that you'll have some degree of immunity.
Mayor Barrett, we had a question about mortuary operations. I believe the National Guard has assisted some places in Wisconsin with this. Have you asked the National Guard for that here in Milwaukee?
We have not asked the National Guard for that, and I hope that we don't have to. But again, what we've seen in Milwaukee is we have seen a decrease in the number of cases that have resulted in death. Again, I look at the state, they're seeing more deaths in other parts of the state right now than here. I hope that our death rate continues to drop because I think that's one of the keys to reopening the economy as well.
I want to bring Tim back in for this one, but we've had some questions about work-safe practices for businesses that are planning to reopen. The WEDC issued some guidelines today. What would you say? We've shared some on the MMAC website as well. What would you say that currently businesses are thinking about or talking about right now, Tim?
Well, I think that, working in concert with the medical college, in, discussions with the mayor and certainly in discussions with the state leaders, that we're going to work in concert with our public health officials, our medical leaders, and our elected officials to bring back businesses safely. And I think the best way that we can help is by helping them collaborate on those best practices and share them. And there is a great, I think, wealth of those on our website. I compliment the state and WEDC for standing those up because I think that's going to be the most important thing for the business community, is to instill confidence in their consumers and in their employees and to share those best practices so we can sustain kind of this new abnormal living with COVID, and also being prepared when there is a spike, how companies can react most effectively and most efficiently. So this is a partnership that's going to need to stand strong over the next 12 or 18 months.
Tim, we've also had questions about how businesses can get their hands on some personal protective equipment. And this is another place where MMAC is making an effort too. Could you describe that as well? And I'll put the link in the chat section here.
Sure. We actually have an exchange site on our website where if you are selling PPE equipment or you're looking for it, you can gain access to it. And the same issues that came through The medical systems are the same issues that are coming through employers as they start to ramp up, and they're looking for protective equipment as their employees come back online in a measured pace.
Tim, maybe one last question for you. We had some folks hoping you could look into your crystal ball and think about what the Supreme Court might tell us and when. I don't know if you have any thoughts on that.
I don't have any, well, I have thoughts on it. And without trying to handicap it, they took it as original jurisdiction. So I would assume they're going to rule next week. And then I'm going to kind of turn this over to the mayor, who I think has done a great job of thinking ahead about what happens with any Supreme Court decision and what we need to do to react here regionally.
Well, I think there's a couple issues here very quickly. I think one, they could uphold the governor, which I don't think they will do. Two, they can strike down his order immediately. Third, they can strike it down over X number of days. Let's just say, for the sake of argument, that they rule on Monday, which would be the 11th. If they had X number of days, we're getting even closer to his original date of May 26th. So it may end up being just a tempest in a teapot over 1 week, and that might be a real week for a lot of businesses, so I don't minimize that. But I think the other question is, particularly because there's a second challenge, a constitutional challenge, if they take that up at the same time, that has the potential to go more toward local units of government and the ability of local units of government to declare health emergencies. And I think that for local officials, that can be equally problematic, because I think regardless of what they do for the state, many people have always assumed that the local public health officials will still have the authority to look at public health in their jurisdictions. That could be under fire as well. So we are preparing for all scenarios. But again, my strongest advice to people is, regardless of what government does, people are still going to have to deal with employees, and a lot of people are just downright scared. And that's an issue that we all have to deal with in our society.
Great. Thank you to the three of you, and thanks to everybody who asked a question today.
Again, Mayor Barrett, thank you much for your time and your leadership during a very challenging period. Dr. Raymond, always a pleasure. Thank you for the consistently factual information that you've been presented. And as we finish up the week in a new abnormal, I never thought I'd be hosting a webcast with my youngest kid cutting my hair. So with that, have a safe and healthy weekend, and we'll see you on Monday at 3:30. Thank you.
Bye, Tim. Bye, Mayor Barrett.
Take care, gentlemen. Thank you all.